Welcome, everyone, to the Case Acceptance webinar. My name is Dr. Carl Durant, and I am excited to have you join me for this brief time. You are in for an amazing webinar, and I want to jump right into it. But before I do, there are two things I want to mention. One, for those of you who stayed to the end of this short webinar, I have a very special surprise for you. You are not going to want to miss out. Secondly, I want to start out by asking a simple question. Why are you here? Why did you choose to attend this webinar? The first thing that comes to mind is probably something like, well, Carl, I want to book more procedures. I want to increase my case acceptance. Yes, this is probably true, but I want you to dig even deeper. Why are you really here? What's the deeper reason? For some of you, it's because you want to work less and make more money. For others, you are tired of doing fillings. You want to do more procedures that gets your blood pumping. And for the vast majority of you, you don't want to end up like so many dentists who have to work until they're 7 years old to maintain their lifestyles. Take the time and really figure out why you are taking the initiative to becoming a pro at case acceptance. In the meanwhile, just another quick reminder, because you have taken the initiative to attend this webinar, I have a special bonus for you at the end. Right now, this bonus is only for those ambitious dentists who attend this webinar and stay to the end. This webinar is going to be really short and to the point. So make sure you stick around to the end. Now, spoiler alert, I am a dentist. I am also a certified neuro-linguistic programmer in sales. I'll explain a little bit more on this later. I am also a body language coach, which I have so much fun doing. And yes, some of my patients think I'm very young, but guess what? It doesn't stop them from spending over $20,000 on their dental care with me. So, how do I double my production numbers using my existing patient pool in such a short amount of time? How was I able to work less days but produce more? In this webinar, I will reveal to you 3 of my secrets that you can use to start taking action today. So, once again, 3 wildly effective case acceptance secrets that if you want, you can start implementing them right away. So let's jump right into it. Secret number 1, building rapport. Most people think you build rapport with what you say. A lot of people think you build rapport by finding things in common with the other person. Most people think that you build rapport by asking questions. Initially, dentists that I coach, they tell me, hey, Carl, look, my patients, they all love me. My next question is, are they booking treatment? The answer is typically no. Now, they are not entirely wrong by thinking that you can build rapport in those ways. However, that type of rapport building could only get you so far. What I'm going to teach you is how to tap into the unconscious mind and build rapport, how to tap into the patient's unconscious, their subconscious, and build that rapport. You see, most people like people who are like themselves, or they like people who are like people who they, aspire to be like. Truth be told, I don't have the same ethnicity as most of my patients. I'm not the same age as most of my patients. I don't have the same profession nor the same life experiences as most of my patients. So if all I relied upon were those types of commonalities, it would be pretty difficult for me to build rapport, huh? The first bonus I'm going to give you is a quick crash course on neuro linguistic programming, and it's NLP for short. And it's a method in NLP called matching and mirroring. Now, in very simple terms, what is NLP? So, words typically make up maybe 7% of communication. NLP, neuro linguistic programming, is the other 93% of how we communicate. Now, back to the example. If you and I were going to, if you and I were at a restaurant and we were just sitting and watching people, I could point out to you the couples or friends in that place that were in deep rapport with each other. How could I do this? You see, when people are in rapport, when they're in deep rapport, their body language tends to mirror each other. They don't even notice it happening. For example, if you see John and Amy are sitting and they're having dinner, you see Amy take a sip of water without noticing it. More times than not, when they are in deep rapport at the moment, John will also take a sip of water, right? But John doesn't know that what probably prompted him to take that sip of water was seeing Amy take that sip of water. It's all happening in his subconscious. Another really good example is a story that I heard Tony Robbins tell about a famous psychologist. Let's say the psychologist's name is Dr. J. Now, people would go to Dr. J when I guess they exhausted all their other options. A patient would come in and they'd say, you know what, Dr. J, I've tried everything and I think pretty much I'm a hopeless cause right now. And, I'm just ready to give up. So I don't even know why I'm here. And Dr. J would go, you know, I can definitely see how you can feel that way. But, you haven't tried the techniques that I'm going to show you. So I do think there's still hope. And I think you should stay. Or if a patient came in and said, you know what, Dr. J, I'm really tired of all these psychologists. I've tried everything. Nothing's working. This is pointless. Then Dr. J would go, you know what? You haven't tried what I'm about to show you. So I think you need to sit down and take a seat and let's work through this. What did Dr. J do to instantly build rapport with these two separate patients? He matched and mirrored. He matched their tonality. He matched their energy level. And the powerful thing about this is that you can do this too. Now, how does this apply to dentistry? If you try these next couple things, you can see how quickly you can build rapport and your treatment acceptance rates skyrocket. Here are some simple things that you can do. Present to your patient treatment when you're both eye level. So many dentists are in the habit of talking to the patient about treatment while they're standing and they're towering over them. The patient's sitting down and the dentist is standing up, hovering over them, telling them about all the treatment that they propose. If the patient's sitting down, sit down. Adjust the chair so you and the patient are eye level. Notice their body language and subtly match that. If their legs are crossed, not right away, but try crossing your legs a little bit. Notice their energy levels like Dr. J and match it. Once you are in rapport with this patient, there's another technique called leading, where you can actually help bring their energy levels up or down based on what you want to do. Now, I want to tell you all of these techniques, but we simply don't have the time right now. But these are just a few that you can implement right away. So, immediately, what steps can you take to start getting better at this? So, practice matching and mirroring. Now, in this picture, you see that the gentleman in the blue he's eye level with the patient, right? That's perfect. But what I would do is I would actually swing around so that I'm more face to face. So like the patient didn't have to turn their head to the left like that. So I would just make it positioned so the patient's head, they would just have to look straight. And do you see how her legs are extended out? And her hands are on her lap. I would also extend my legs out just like she's doing. But you see how his legs are tucked in under his chair. I would extend my legs and just kind of keep my arms down. And you don't have to mirror the patient exactly, but just the same, just in overall the same posture, the same mannerisms there. And you'll see how you'll see how powerful this technique is. You know, so once again, this is something that you can start doing right away. The next secret is I've learned case acceptance from some of the most successful dentists in the world. literally. And something that we all figured out that we do is have models during your treatment plan presentation. Something dentists that I coach forget is that patients don't know dentistry like they do. Okay. A lot of patients don't know what a crown is. Most patients don't really understand what a veneer is. People don't have a solid understanding of how implants work. If you just, if I were to describe to you right now this painting that I'm looking at, and I asked you to draw it, how accurate do you think the painting will be? Right. And, if I told 100 people, if I described 100 people the painting that I'm looking at without showing them the actual painting and I asked them to draw it, I'm probably going to get 100 different paintings. When you propose an implant to a patient in their head, in your head, you know how small it is. But the patient, however, could be thinking it's this huge screw that you're going to hammer into their head. That is why models are so important. So, what can you do immediately to rectify this, right? Order models for your office. But if you're not going to order models for your office, have some images ready on a tablet or on the computer where you can actually show the patient what it is you're talking about. You can show them how a crown works. And I personally like models for, because the bigger cases that I do, for example, if it's a implant supported denture or whatever, all on four or like whatever the case is, or veneer cases, like I like the patient to hold the models, to play with it, to turn it, to really get a feel for it. So I want to engage their senses. That's why I like using models. But like I said, if you're not into ordering models, then images also, images online or on tablet also work very well. Secret number 3. This is one that I really enjoy coaching because I know that so many people get hung up on this. So, secret number 3, overcoming objections and speaking the patient's language. This is what so many dentists struggle with. I said I was going to keep this webinar short. So I'm going to share with you one main strategy that will take your case acceptance to the next level, and you'll see. I can't wait for you to try this stuff because it'll just everything will unfold right in front of your eyes. How familiar does this following scenario sound? Amy plans to get a group of friends together for dinner on Friday night. She calls Janet and says, "Hey, I'm planning a dinner on Friday night, and I want you to come." Janet says, "That sounds like fun, but I can't make it." Amy says, "Why?" Janet says, "Well, my car's been making this funny sound lately, and I don't think it's a good idea for me to drive it." Amy says, "You know, no problem. I'll give you a ride." Janet says, "Well, also, I might be working late that day, so I could be cutting it close." Amy says, "Hey, no worries. Most people usually show up late anyways." Janet, now sensing that Amy is not letting this go, she says, "The truth is, I have a huge pimple on my face that I'm self conscious about, and I doubt it will be gone by Friday." Amy says, "Hey, look, I have this awesome makeup technique that will probably cover it right up. Come to my place 30 minutes earlier, and I will take care of it." Janice says, "Thank you so much. I'll see you then." The point of the story is simple. Patients sometimes are not completely truthful with the initial reason why they're not doing the treatment that you propose. One simple technique to use is this: take whatever objection they have and put it in the following blank. If blank wasn't a factor, what would you do? What would stop you from moving forward with treatment? Once again, if blank wasn't a factor, if money, if pain, if time, whatever, fear wasn't a factor, what would stop you from moving forward with treatment today? Watch how the truth comes pouring out. So the concept here is you isolate their objection. You take their objection away so that you can get to the deeper reasons or just to make sure that that's the reason why they actually aren't doing treatment. Now, once again, I want to keep this webinar short. I really want to tell you all the steps and how to isolate the objections and then take them and then into schedule and all that. But this is something that I know that you can start implementing right now. Um, so that's why I wanted to share this one powerful secret with you. So, immediate action steps: make a list of objections you hear and then make a list of responses to give to that objection, right? So, as I said before, I'm keeping this short. So, these are just a couple of powerful techniques just to get you started. If you found this webinar useful, I am so confident that you are really going to like the bonuses that I have for you. So this is what I was excited about is all these bonuses. Now, I offer a personal one-on-one coaching. If you want to become extremely confident in treatment, presentations, and sale, this coaching package is for you. If you want to start booking high value treatment plans on a consistent basis, this is for you. If you want to be skilled in the art of overcoming objections, this coaching package is for you. If you want to allow yourself the option to work less and increase your return on your time, so many dentists that I've talked to that have gotten case acceptance down like a pro. We all tend to kind of do similar things. I talked to one guy and he was telling me, yeah, I only work 8 to 12 now. And I take the rest of the afternoon off because my production is just so good in those couple of hours that I only work half days. I don't work full days anymore. And I started doing the same thing. Like I don't work full weeks anymore. And it's great. So if you want to allow yourself that option to, be more flexible with your schedule, then this is the coaching package for you. It's because the goal is to get your case acceptance up way high. you know I've only had time to scratch the surface today, but with this coaching package I personalize it to fit your needs. You will learn the best neuro-linguistic programming techniques and case acceptance techniques. Remember, the neuro-linguistic program, that's 93%, close to 93% of communication that most dentists, hopefully not you in the future, are missing. That, like, you're missing a big chunk of this 93%. And I want to make sure that you have that down packed so that you can get your case acceptance to the next level. Now, how is this personal one-on-one coaching work? It's 1 hour per session, which is scheduled at your convenience. And we're going to be on an interactive video call so that we can connect. It's interactive. We're going to talk back and forth. You're going to ask questions. I'm going to give you the material. And we're really going to make this experience so great. And that's why I like to personalize it. I like to find what your weak points are. I want to find what your goals are because I like to deliver value. I want to make you feel like you got a whole lot of value out of these sessions. Now, if after the first session you feel as though you are not getting what you expected, it's not what you expected, fine. No questions asked, 100% money back guarantee. I absolutely think, though, that this will not be the case because I know how successful this program, this package has been to so many dentists that I've worked with. So, but once again, I just want you to know that that option is there. Disclaimer, this package is not for everyone. You're going to learn some very powerful techniques. And the number one rule is that what we do is it should be for the betterment of the patient. It should be in the patient's best interest. And disclaimer, this is for ethical dentists. Like, results may vary. That's number one, because based on the time and effort that you put into this and a whole lot of other variables. But I want to really coach ethical dentists because you're going to be learning some very powerful techniques. And this package is only for dentists who are willing to get out of their comfort zone and for dentists who are willing to put in the work, because this is not an overnight thing. This is going to take some practice. But when you have this material, when you have the tools to do this, oh my goodness, your career has the potential to drastically improve exponentially. Now, I want you to hear from actual dentists that I've worked with. I have a simple objective. I want to deliver immense value to you. I've been in a place where my case acceptance was low. I spent thousands and thousands of dollars to figure this out. And I want to help you get to where you want to be. I also don't want you to miss out on hundreds of thousands of dollars of production in your career because your case acceptance was low. How do you claim this special bonus package? Near the end of this presentation, there will be a button below that you can click. Click the button to claim your bonus. Now, I have to tell you, this bonus is a limited edition. It is a limited offer. When you find out what it is, you'll know why. This package value is so good. Once again, it's only available for a limited amount of time. Because you took the time to watch this webinar, I want to make sure you take full advantage of this coaching package while it lasts, because this is only open to you who stay to the end of this webinar, who stay to the end and wanted to claim the special package. Once the registration period ends for the one-on-one coaching, enrollment will be closed. And I can't guarantee that this special bonus package will be offered again. Don't miss out. Like you've probably read in my testimonials, I go the extra mile. I get so much fulfillment in seeing the dentist that I work with succeed. Think about how happy you will be a year from now when you look back and realize how just by increasing your case acceptance, by taking this initiative, you were able to better treat your patients, do more procedures that excite you, increase your production while working less, be more in control of your time, spend more time with family and friends, and make your career what you want it to be. Really, click the link below and claim your bonus package today. I am so excited for you.